Thank you for joining us for this segment of Live Healthy. I'm your host, Lauren Collar. There are two different kinds of stroke. What are they, and what does that mean as far as treatment? Joining us today is neurosurgeon Dr. Douglas Stofko, here, a new member at Trident Medical Center. Thank you for enlightening us on the different kinds of stroke.
Yeah, thanks, Lauren. So there are two different types of stroke. There's what we call hemorrhagic or a bleeding stroke, as well as an ischemic or a stroke where the blood flow doesn't get to the brain and ultimately oxygen doesn't get there. We have different ways to treat those types of stroke, specifically here at Trident Medical Center. For ischemic stroke, which is the vast majority and what we think of as when we hear stroke, not only can we give clot-busting medications if those patients are recognized and brought to the emergency room in a timely fashion, but we can also do what's called mechanical thrombectomy, or what we call endovascular treatment, which myself will make a little nick in the groin, thread a catheter through the blood vessels, and actually go up and retrieve that clot that's causing the blood flow or lack of blood flow to get to the brain. As well as the other type of stroke, which is hemorrhagic or bleeding type stroke. That's where a blood vessel unfortunately ruptures or bleeds. What we can do here as well, we can actually go endoscopically with a little scope and go in and actually take that clot out, which we've been shown to decrease the amount of stay as well as the overall improved outcomes of patients that have that procedure done.
What do you specialize in here?
I do both of those. So I'm the director of stroke as well as cerebrovascular endovascular neurosurgery. So bleeding conditions of the brain, aneurysms, which are blisters on the blood vessels, AVMs or arteriovenous malformations, which are an abnormal tangle of blood vessels in the brain. I specialize in treating those both open, with open cranial surgery, conventional, when you think of brain surgery, as well as endovascular, where again we make a little nick in the groin and go up through the blood vessels themselves and can treat them in various ways.
For both kinds of stroke, time is important.
That's true. Time is literally brain. So every minute that a blood flow and ultimately oxygen is not getting to the brain, about 2 million brain cells die. So as you can see, coming to a center such as a primary stroke center, where we have dedicated teams, as well as endovascular treatment to treat these patients, really does improve outcome because we're able to get those clots retrieved in a timely fashion.
All right, thank you for joining us, and thank you for being here for Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and is provided as a service to you and your family.